Welcome everyone to the most anticipated, jaw-dropping, and slightly concerning event of the year. The best of the worst, back in Earth. Introducing our hosts, Bianca Castillo and Nathan Javier.
Ladies and gentlemen, welcome to your most chaotic, disastrous, and hilarious episode of Tanginers! Today's show will have a roller coaster of emotions, like a hospital disaster movie in real life.
Today we are exposing the biggest communication failures in nursing.
We've searched far and wide for the most horrific, cranky, grumpy, and overly friendly nurses.
We found not just one,
Not two,
not three, but four nurses who make the stay of their patients into a nightmare. And folks, we found them. We are unforgettably terrible nurses in the medical field.
but babe, or before anything else, let's first talk about the most important but easily overlooked skills in nursing communication. And after what we're about to see later, we'll realize how much it matters.
Let's discuss something that is crucial in nursing. Because, let's be real, a bad nurse isn't always bad because of their skills. Sometimes they just have horrible communication.
And that's why we have our special guest with us today. Let's all welcome our communication expert, our chief nurses, Miss Daniela and Miss Eritea.
Who you gonna call? Chief Nursing.
Alright, chiefs, let's start with the basics. What exactly is communication and why is it important in the field of nursing?
So, communication is how we exchange information, thoughts, and emotion. But in nursing, it's not just about talking. It's about talking with other people to are communicating with other individuals to ensure their safety and effective care.
So it's more than just words.
Yes, exactly. It's an exchange of ideas, facts, information, and feelings by speaking, writing, or using other mediums. There's verbal communication, it's what we say and how we say it. Then there's nonverbal communication like body language, facial expressions, which sometimes we do more than words.
Right, because if a nurse says, "You're completely fine now," but looks annoyed, the patient would feel reassured.
So basically, if a nurse speaks rudely or rolls their eyes, the patient already knows, oh no, I'm in trouble.
Exactly! Nonverbal communication can be as just powerful both negatively and positively.
Yes, and that can make a patient feel uneasy or hesitant to speak up. That's why nurses need to be aware of both what they say and how they express it.
Wow, so communication is way deeper than we thought.
Yes, and when done properly, it could build trust and improve patient care.
Well, we've talked about what good communication looks like. But what happens if communication goes horribly wrong? It's time to meet our nominees for
The Worst Nurse Awards! So now let's meet our first nurse. Let's give it up for Nurse June, who is overly friendly, chaotic, and unprofessional.
Oh my god! Oh my god! Oh my god! Hi everyone! Oh my god! Say hi!
Roll VR!
Already 8. Oh my god, Zach! Hi! Oh my god, I'm the cutest here! And it's so great to meet you too, man! I recently graduated from Philippine College. And oh my god, this is such a great opportunity. You're my first patient. So firstly, what's your name?
My name is Angela.
Oh, Angela, do you know what whose name's I actually know someone whose name's Angela. Why you don't know? You don't know? Alright. So what are you here with? I'm here.
So I don't feel well. So I have a fever for about 3 days. It is on and off, and then usually my tummy aches and
What? What did you say?
is it too close?
No, it's okay. So I can hear you.
My tummy aches and also I feel nauseous every time.
Hey, that's fine. It's just a simple fever. So let's start our assessment now.
What are you doing?
I'm doing a skin assessment. Oh my god, what's this? What's this? Oh my god, what's this?
That's my birthmark.
Really? Do you have a boyfriend? Did your boyfriend did this? No, it looks like it.
No.
Oh my god. Is he for real with that approach? What went wrong, Chiefs?
Nurse June used excessive informal communication. He assessed the patient without telling it first and the procedures he will do.
He must always approach his patient in a therapeutic way. He must be professional while showing empathy instead of acting like Angela's best friend. He should have said,
I understand your condition, ma'am. Is it okay if I will further assess you and ask some questions for history taking? I'll be here to make sure that you're comfortable.
So now let us welcome our second nurse, the insensitive to religious belief, Nurse Cal.
So, sir, how did you...
Wait lang.
How did you become one of our
Wait lang, last na. Final na.
Okay, so how did you become one of our nominees?
I don't care, just scroll the BTR. Okay, this is the room of Miss Isa.
Yes, why?
Okay, ma'am, I want you to sign this document so we can perform the blood transfusion for you to live, okay?
No. No, absolutely not. We cannot agree to this.
Why?
We're Jehovah's Witnesses, sir.
Sir, I don't care if you are Jehovah's Witnesses. The life of the patient here is in the line, okay? That's the important here in our hospital.
No, even if you save her, you will only condemn me in the afterlife.
No, ma'am, you need to sign this, okay? For you to
No.
live.
In our religion, blood transfusion is not allowed. No, absolutely not. I'm sorry,
You know what,
you need
sir?
to leave.
If you don't want to do this, if you don't want to sign this so we can perform the blood transfusion for the patient to live, then don't, okay? I will leave, no? Kasi I have a lot of patients to check.
Oh my god, he did not just say that.
Nurse Cal ignored cultural sensitivity communication, which is essential in nursing. That was completely disrespectful to the patient's beliefs.
he should respect his patient's autonomy and beliefs and must always approach them in a holistic way. Instead of dismissing, he should have listened actively and asked,
So tell me more about your concerns so we can explore options together. I will give you alternatives for a while as I coordinate with your doctors.
So now let's meet our third nurse, the judgmental, discriminatory, Nurse Santino.
Hello everyone.
What's up? I'm here now.
Roll VTR.
Okay, next. Ma'am, could you please step on the waiting schedule? Well. Looks like someone is enjoying their meal.
Yeah, I guess I did
A little? Oh, honey. This can really cry when you step on it.
I know. I need to lose some weight. That's why.
Let me guess. Are the full-time achy joints?
Something.
Oh, sweetie. It's just basic life. Others eat. I guess.
But I'm proud.
Right, that's what everyone says.
You know, I came here for help, not to be judged.
Oh, no judgment. Just answer.
Discrimination. That's just straight up discrimination.
This is a huge problem in healthcare, fat shaming. Instead of making the patient feel worse, he should have used non-judgmental communication.
He should be more empathic and use respectful language. His tone in body language made the patient feel ashamed. Instead, he should have said,
I'm here to help. Now, let's find a care plan that works for you and support your health goals.
Now let us welcome our last Down in Nurse nominee, the grumpy and the rude Nurse Casey. Roll VTR.
What's your name?
My name is Amanda.
How are you feeling right now?
Right now, ma'am, she has a fever since last night.
Is that your Resha?
Yes po.
Okay, do you have any headache?
Yes, I feel as I said, ma'am, she has a fever since last night.
Actually, ma'am, I'm not talking to you. I'm talking to Resha. So please shut up. Did you eat anything weird before you got sick?
No, ma'am, she keeps vomiting.
Just say yes or no.
Yes. Is that how you treat your patients?
I'm just doing my job. So if you don't like it, I will leave.
What kind of nurse is that? So rude.
She did not just shut up our patient's relative. How rude of a nurse she is.
Even though we are not talking to our patients' relatives, we must ask them in a respectful manner. We need to know that they are just concerned with their loved ones.
a patient in pain needs compassion, not attitude. She must act in a positive nonverbal communication. Instead, she should have said,
I hear you. Let me check on your daughter first and I will be giving her medications and schedule. We will see what we can do.
So now, let's proceed to our favorite segment of this show, the Fast Talk. So we will ask rapid-fire questions to test our nurses if they have finally realized and learned from their mistakes.
For the first question, what do you say if a patient asks, "Am I going to die?"
Me, probably. No, it's 50. I don't think so.
No, we will do everything to make you feel okay.
At least Nurse Casey learned how to appropriately approach her patients properly in a therapeutic way.
For our next question, a patient says, "Nurse, I think I'm hearing voices. What do you do?"
Oh my god, same!
Me too, but I'll be here with you. Let's work on it together.
Guys, stay calm. I'm here to listen. Tell me more about it.
Then there you go. Nursing team will also learn how to communicate in a holistic manner.
A patient suddenly screams, "Nurse, I'm having a heart attack." What's your first response?
Same. I'm panicking too.
We will do everything for you just to make you feel good. And I will call the doctor right away.
Don't worry, I will be doing the first aid response as we wait for your doctor.
Stay with me. I'll call for help right now.
Now we have Nurse Cal with us. They are slowly learning proper communication techniques and treating patients with compassion and professionalism.
And now for our last question. A patient's family member angrily asks, "Why is my mother still in pain?" What do you do?
I know this is difficult for you. Let me check her pain management plan to see what adjustment can be made.
I hear your concern. So by that, let's work together with the doctors to make she's better and comfortable as much as possible.
I understand your concern and I will be checking the chart and see what we can do to help.
I understand your pain. We're doing everything that we can to help her. Don't worry, your mother is in good hands.
So now our nurses have learned that communication is more than just words. It's how they respond, how they listen, and even use their body language. A good nurse is a good communicator. When we communicate well, we heal not just their body, but also their heart and mind.
To Nurse John, Cal, Santiago, and Casey, communication is not just talking, it's about respect, professionalism, and empathy.
Whether it's too casual, insensitive, judgmental, and grumpy, bad communication makes patients suffer.
Wow, what a roller coaster of a show. We laughed, we cringed, and most importantly, we learned the importance of communication in nursing. And let's be honest, these nurses gave us major secondhand embarrassment, but at least we've learned that communication can be improved.
So, nurses out there, remember, listen to understand, not just to respond. Respect cultural and religious beliefs. Use words, tone, and body language that promote trust. And most of all, treat every patient with empathy and dignity.
Our patients don't need a stand-up comedian, a grumpy troll, or even a personal trainer shaming their weight. They need a professional, kind, and respectful nurses who listens and understands.
And if you don't, well, you might just end up on the next episode of The Worst Nurse Awards Part 2, the sequel no one wanted. And before we go, let's give a round of applause to our worst nurses who learned how to become a better nurse. At the end of the day, our patient will remember how we talk and how we make them feel. So, alright folks, that's a wrap.
Tang!
Tang!
Nurses! This has been Tang Nurse, where the only thing worse than bad handwriting is non-therapeutic communication. Bye!